If we don't stand up for children, then we don't stand for much. Miriam Wright Edelman's words remind us that the choices we make today shape the opportunities children will have tomorrow. One of the most pressing issues in early childhood special education is the limited and inconsistent access to early intervention services for infants and toddlers with developmental delays. Today, I stand strongly in support of expanding access to high quality, timely early intervention so that every child, regardless of background, receives the support that they deserve. The key stakeholders affected by this issue are young children with delays or disabilities, their families, early childhood educators, and early intervention specialists. Each of these groups play an important role in identifying needs and addressing them. Research supports early intervention as one of the most effective strategies for improving developmental, behavioral, and academic outcomes. Studies such as the Division for Early Childhood (DEC) show that the brain development is most rapid in the first 3 years of life. When children receive early supports, such as speech therapy, occupational therapy, or family coaching, they experience long term benefits in communication, cognition, emotional regulation, and academic readiness. Despite the strong evidence, current access to early intervention is not aligned with best practices. Many families face long waiting lists, inconsistent eligibility criteria across the states, limited provider availability, and challenges navigating complex systems. These barriers disproportionately affect families in both urban and rural areas as well as low-income communities. When children miss the opportunity for early support, we are not only ignoring research, but we also risk widening developmental and educational disparities. To address this issue, I advocate for three essential actions. One, increase funding for early intervention programs so states can reduce wait times and hire more providers. Two, streamline identification for, I'm sorry, streamline identification and referral systems with a focus on pediatric partnerships and community-based screenings. Three, expand family-centered support, including culturally responsive services and clear guidance to help families navigate the system. These changes would significantly optimize learning opportunities for young children, strengthen inclusive environments, and advance an early childhood profession by ensuring educators and specialists have the resources they need to do their work effectively. Professional organizations that support this cause include the Division for Early Childhood (DEC), the National Association for the Education of Young Children (NAEYC), and Zero to Three, all of which advocate for evidence-based support for infants, toddlers, and families. Finally, promoting equitable access to early intervention reflects the Christian worldview by honoring the dignity, worth, and potential of every child. It calls us to serve families with compassion, justice, and intentional support. When we expand early intervention access, we promote the common good, not only for students and families, but for educators, communities, and future generations. Together, we can stand up for young children. And when we do that, we stand for something that truly matters.